It was a story that was certainly overshadowed by the government shutdown and the debt ceiling battle. But with those crises over, at least for now, attention once again turning to the serious problems plaguing the Obamacare debut. And there are now growing calls for someone to pay the price for all the glitches or serious problems. Brian Todd is here. He's taking a closer look at this part of the story. Brian, what's going on?
Wolf, right now, that someone you mentioned is Health and Human Services Secretary Kathleen Sebelius. Republicans are now publicly equating her with the rollout mess, and they're turning up the heat. She's become the face of the Obamacare rollout and all its technical problems. And there's intensifying pressure on Human Services Secretary Kathleen Sebelius to step down. She's the chief target of Republicans, including Senator Pat Roberts, who's a longtime friend of Sebelius's family.
Secretary Sebelius has had 3.5 years to launch Obamacare, and she has failed.
Roberts is joined by Republican Congressman John Fleming of Louisiana. A longtime family practice doctor, Fleming says he'll soon send a letter to President Obama asking him to accept Sebelius's resignation. Fleming says he's gotten other House members to sign it. I presented the White House's defense of the healthcare sign-up website when I spoke to him. It's getting better. The problems are being streamlined more and more each day. That's what they're saying. Not good enough for you?
Brian, that law was passed almost 4 years ago. They've had plenty of time to either roll this thing out properly, beta test it, make sure it works, or delay the implementation. They did neither.
Secretary Sebelius's aides said she was traveling and not available to go on camera. They didn't respond specifically to the calls for her to resign, but did refer us to comments from the White House earlier this week.
The secretary does have the full confidence of the president.
But President Obama's former press secretary said this, quote, "I hope they fire some people that were in charge." And there are 2 House committees investigating the website launch.
They will make sure that Obamacare is the story of the day, most days of the week, for months and months to come.
Sebelius said this on a tour promoting Obamacare this week.
Now, I'll be the first to tell you that the website launch was rockier than we would have liked.
And potential customers are still shopping. A company that analyzes web traffic says after the first week online, out of all those who attempted to sign up through the federal exchange, just 1% ended up enrolling in Obamacare. Administration officials say that's not accurate, but they are still not giving any specific numbers right now on actual enrollments. And we have to emphasize that company's data is unofficial, and it's just a snapshot. It does not include state-run exchanges. They just mentioned the federal exchange in that one study, Wolf.
All these problems, though, with the website certainly undermining a key goal of this entire health care law.
It really is. You know, right now, analysts are saying that with all the problems with the website and the fact that Republicans are now turning up the heat politically on all of this, they're going to have trouble. The administration is going to have trouble getting young, healthy Americans to enroll in this program. They desperately need the young, healthy people to enroll in order to subsidize the older, sicker people who they're also going to be covering. They needed to get off to a good start with the younger, healthier people enrolling, and this may be a problem in doing that. Getting off to that good start, they're clearly not off to a good start.
Yeah, they got to fix it. As I say, they fix it quickly. Brian, thanks very much. Let's get some more now on some of the problems with the Obamacare website. We'll bring in our senior medical correspondent, Elizabeth Cohen. She's been working this part of the story since it was unveiled on October 1st. Elizabeth, what are you learning now about potential problems with people's passwords on healthcare.gov?
Well, you know, Wolf, it's interesting. I tried to get a login and password and finally managed to get one on October 9th, but it's never worked. Till this day, it doesn't work. And so I called the call center. I spoke to 5 different reps, and they all said the same thing. They said if you got a login and password relatively early on in the first week or so of the site's existence, then some of those passwords have been deleted, and so your login isn't going to work. And I was surprised to hear this, and so they talked to me about different things that I could do. I could maybe create a new account. And Wolf, here's an interesting twist. So I called and spoke to a senior Obama administration official, and she said that the call center, who are their contractors, by the way, that the call center is getting it wrong. She said that they're saying the wrong thing, that they're reading a script that was given to them by mistake. She said passwords have not been deleted, but she did say, you know what, some people who got passwords and usernames relatively early on, that they may be having trouble logging in, and if that's the case, they should call the 1-800 number and get help. And she said, look, if you want to just create a whole new account, you can also try that too.
Seems that all these glitches, all these problems are obviously getting in the way. We're finally hearing some data on how the website is doing. I take it not necessarily all that great.
Right. Unfortunately, the federal government, the Obama administration, hasn't released any data, even though they said they would release some metrics this week. We haven't seen them yet. But it's interesting. The state of Wisconsin told us something. They said that from October 1st to October 8th, that fewer than 50 people enrolled on the healthcare.gov site from Wisconsin. Wisconsin uses healthcare.gov. So fewer than 50 people in Wisconsin enrolled. Now,